Thank you so much. Thank you. Wow, it was powerful words that you really brought towards us. You really were able to bring up the history, but then also today's current times. So, what I have, my first question to kick us off, our dear brother, is really looking at how do we talk to our communities about getting this vaccine? When we know that there's been documents of events that we see now in the past and present that our government has really led us to mistreatment and then also experimenting on our people for just scientific purposes. So, what would you say for that?
Thanks, uh, DeAndre, for the question, and I agree. I mean, part of it is acknowledging and being true to what has happened and knowing the history. And I think, as I was saying too previously about really where do the problems lie, and I think there's a lot of work that needs to happen in healthcare system, in public health, and the scientific field too, and work around racial equity, anti-racism work to really come to terms with the history that has happened and why we are here and the current situation exists. Also, there are things that have happened with the current vaccine development that I think also have a lot of people concerned in terms of the quickness and how things have happened so fast. And I think there's a distrust of that particular process. So I think, as part of this is to really talk truth. And I think there are things currently in terms of the current process that are and being transparent they're actually quite positive that begin to show a different kind of process. For example, I mean, there are a significant number. There's two vaccines right now that have been approved. That's the Pfizer and the Moderna vaccine. There have been significant contributions by BIPOC communities in the development of the vaccine. Also, in those two vaccines, there's been significant levels of in the trials of involvement of racially diverse individuals and populations and thousands of people who've been involved in the trials. So I think it's not about necessarily convincing people that this is the right thing to do. It's can we be transparent about the process and provide the information and say what has happened and the checks and balances that have been in place, given noise that's been happening federally and other things. So then people can actually make that decision for themselves. We don't want people to be forced into, being vaccinated. At the end, they need to have the information that they need. They need to talk to their community, to their faith leaders, to their doctors of color to get that information and get a sense of where the community and then also see how the current vaccination goes. And the fact that also there have been some adverse effects, very limited though, and at the same time we're going to be seeing here, and we're seeing soon millions of people being vaccinated. And so just being able to see and people witness for themselves kind of the cost benefit of that, I think is going to be really important. But it's a bit of being, I would say, at least from the public health perspective, it's so important to just be transparent and provide people the information. That's the best way to begin to address the past wrongs and getting, so people know exactly what they're getting into.
Thank you, my brother. Thank you.
Thank you, Brother DeAndre, for starting with that question, because it's extremely important that we remember the past. As we say in the African tradition, that we take Sankofa, which is it's good to go back so that we can bring the knowledge to the forefront and make good things happen in a good way for our communities. And so my question for you is that the older generation is going to remember, even if they remember information that may not be completely how can I say, full of the science, they still will remember the effect that it had on the community, on the Black community. So my question for you, beloved Dr. Matias, is how do we and what plans do we have to bring along or to communicate with the older generation and to gain their trust?
And I think with also with COVID, I mean, we know that the biggest impact is among the older population. Now, the prioritization groups are the older population and either those in home care or long-term care facilities. So I think that's going to be continuing to be a really important area to be able to focus on. I, at the end, we don't, we need, there's a not one size fits all answer for this, in the sense that each community is different. And you think about the Black community with the Tuskegee experiments, you think right now Pacific Islander communities being, has been, devastated. They have some of the highest rates, about 5 to 6 times of the most impacted. And you start getting into different communities that have different language communities. We have significant area populations of Marshallese communities who also, if we know the history with Marshallese Islands, Marshall Islands, we know the history of colonization. So I think for each group we need to have very focused approaches and very specific approaches on working with each community. So this is not an easy task. And I think at the end, having those conversations, having the institutions and public health listen, that's actually what we're doing now too, and funding organizations so they can actually have these conversations, to hear those questions, hear the concerns, hear the doubts that they have, and then have people from these organizations. And that's why the work that we all do, also as we try to racially diversify our workforces and those kinds of things, we have very significant doctors, African-American doctors, healthcare providers who know the issues and have been very involved. And we need to also have them be in the front lines of this. And I've seen it already, how different it is when you actually have a white provider versus a provider from those communities actually talking to their community. You get straight away, you get a different reaction and a different connection. So we need to have within our communities, have to have these very specific conversations and be able to answer the questions that people have, because the questions are legitimate. The questions are very legitimate.
Yes. Thank you for that answer, Dr. Matias. And I have a follow-up comment and question to this. President-elect Kamala Harris, one of her first actions early in the aftermath of the election is that she went into some of the poorest neighborhoods in Washington, D.C. and got her shot. And it was it was the Moderna vaccine. So one of the ways in which our community has been asked is that we show leaders, we show you better than we can tell you. So we need to have our clergy, public servants, our educators to go and roll up their sleeves and put it in their arm themselves and be seen doing that. So I'm going to turn it over to Brother DeAndre, because I'm sure he's got some questions that that students have been bringing to him.
Yeah, thank you. And that's a powerful point that you made, Dr. Hunt, on that. And that rose into actually the question that I have, and that is, we know that the vaccines are going to be distributed in big hospitals, and we know those places are not in our poorest of communities for our Black and brown communities. But what advice do we give them, brother, to advocate for their communities where they don't see the vaccines coming and things of that nature? So what do we say to them?
Yeah, so that's a great question, Brother DeAndre. I mean, right now we're still very early on. We're really vaccinating what's considered the 1A and the very first portion. So healthcare providers and those that are most at risk. And so public health, we have set up some vaccination sites, but it's specifically for those populations. And hospitals have been doing the same. We are now announcing and unveiling our plans and our approaches. There's going to be many modes to get vaccinated. So still, it's going to be through healthcare providers. It's going to be through drugstores. All the plans are in the works. And what public health is going to be playing a critical role is creating both mass vaccination sites and also mobile sites. So if people who live in our region of King County have seen, now you can actually get tested throughout the county. So, and a disproportionate number of those now are in South King County. So what we have done is we want to make sure those people, and when I've been talking about the statistics, we know communities of color are in South King County heavily, though that's where we've had most of the COVID infections too, or disproportionate numbers of it. So we are adjusting our strategies to where we have the greatest needs. And we want to create, and we've made already some initial commitments at the county and working with other partners to begin to have these mass vaccination clinics. So at the end, and really low barrier. So it's almost now when you also go get tested, if you're undocumented, if you don't have insurance, those are not barriers. You don't get asked things like that. So at the end is where, just as now you can go and get the swab to be tested, the idea is now you'll be able to drive up, get the vaccine, or everybody in your household will get the vaccine, and make it as easy and seamless for people as possible. And really, for us, it's really to be this that safety net provider and making sure that people who are most impacted have that access. And then also having mobile units and others that will be able to go to people who are not also able to vaccinate. So I think that's extremely important. It's a huge concern that we have to be able to really get those folks who are most impacted vaccinated. And we're going to need a lot of other folks because we can't do it all, and that's where we need business and employers to vaccinate, and we need the public or the private sector to really step up as well.
I have a response to this. I'm so excited you're speaking to this, Dr. Valenzuela, because in town hall for, it was called the Black Coalition Against COVID-19 and what the public Black community needs to know about the vaccines. The National Urban League President Morial made it very plain that it's extremely important we find other ways of getting the vaccine out to our larger communities rather than just a distribution to the drugstores and the hospitals. And so what we're doing, what you're telling we're doing in King County, we're being flexible. That means y'all have been listening. King County has been listening to the Black and Brown community, that we have to have another way in which to get to folks. And so thank you for that. Thank you for that. Our beloved Dr. Betsy Hasegawa is also with us and may want to ask a question of you.
Thank you, Dr. Valenzuela. It's just really such, it's so great to hear your words, your thinking, and your perspective. You know, what I'm really appreciating is the links that King County is making between with public health and racism, and making that really transparent and really starting to build policies to counter that, you know, so that part of the history making that we're doing, that we're involved in at this point in our collective reparations work is about centering health in a real equitable way versus in an economically profitable way. So you know, so I am just really appreciating kind of the positioning, and there's so much. It's like we're, you know, I feel like we're at a point where in some ways the unholy blessing of COVID is that it's making these things visible, and we cannot act as if we cannot collectively act together to do things. So I'm appreciating the lead that you all are taking, and the inclusion of the community voices. So I don't really have a question yet. I'm going to listen some more, but I just want to say thank you. I want to join in by saying thank you so much.
Thank you for those comments. And one of the things too is that we need to give credit to where credit is due. And I think part of it is, you know, King County as a government and institution at this point, and public health, we are responding to community. So when we made our declaration of racism as a public health crisis, there were calls and requests, and community has been calling for this. Organizations have been calling for this. Black-led organizations have been calling for this. And the many things that when I talked earlier about the budget and some of the things that we're doing in terms of our policy and really divesting from the criminal legal system and putting in and trying to create systems that more support and uplift much more of a public health approach to where we invest. These are also, they're backed by best practices in public health, how we should be investing in communities, but also it's the wisdom of community. They have been asking for this. So they have been asking for us to address the issues in the criminal legal system and to really move away from some systems that cause a lot of harm. So think as part of this, the role of community and actually us as government and as institutions taking the lead from community is extremely important, because that's where the wisdom lies. And when we begin to look at structures that are still not based on traditional, models of white supremacy and white dominant culture, we're going to need to look at the different models that exist, even including in this space, the other ways of doing and thinking about things that will essentially look very different from what we have right now.
Yeah, no, and I totally appreciate the recognition of racism as a comorbidity. It's like, like some of the so many of the health issues would not be there for Black and Brown communities were it not for the historical injustices. So it makes me feel hopeful about our country in a weird way.
I want to bring into the room, into the space, the student voice really quickly. And when I say that to the perspective, as we know that we look at this pandemic and we look at what we're going through, and we're talking about this vaccine, but on the same token, because of the city shutting down and hitting our economic system so hard and so tough, I think about our students who are about to graduate, and they're like, when is this going to be over so I can get into the job industry and get back to a way of life? What would you tell those students as a public health person that you are, dear brother? Like, do we know when we are going to really turn? Do we know when an upside? We have a vaccine, but what does that truly mean to our students to give them, I don't want to say hope, but a little encouragement to say, hey, let's keep fighting? Do we have anything for them?
Especially for young people right now, just the two vaccines that we have, at least for children, they're not approved yet, and they're not approved yet for pregnant women. Also, most young people, if they are healthy, they won't have access to the vaccine in the early rounds and then the next months, and it's not going to happen till probably around the summer, late spring or summertime, when it'll be accessible to everybody who wants it. And I think that's really going to be important. But I think what the role of young people is extremely important, because we are also trying to get to a certain level of immunity and vaccination throughout the community, which is around 70%. We need young folks who are very active, who are, whether it is in work sites or in sports or whatever activities that they do in our social settings, to actually be vaccinated, because those are the folks that then go to homes and other places where we're now seeing a vast number of our infections, and then infecting people who are more at risk. So I think young people are going to be playing a critical role around getting vaccinated and making sure that we get to the necessary rates to be able to fully recover. And once we have that, then we will be able to see more of a return to normalcy in terms of economic activities and those kinds of things, which will then allow us to get the economy back on its feet, and then there'll be more opportunities for young people again. So we're all part of the solution. We have to be, and that's why it's so critical it's a all hands on board, I think, effort here to get our community healthy, at least with COVID-19. And then I've appreciated what you all have said also around the insights that we've gotten into other issues and other inequities, and then we can actually also take some of these learnings that we can accomplish some great things. We've been able to accomplish great things, but we need to get there and then see how do we take some of the other challenges that we have before us, especially in terms of racism and inequities.
Let me just follow up real quickly. Thank you. You did exactly what I needed you to do, Doc. And that was encourage the young people that they play a true role. So they want to get back, but they got to play their part. So to our students that's watching, I hope you just heard what Doc just said. So thank you for that.
Yes. I want to also turn our attention to the young people, the future, who are part of creating the vaccine and doing the tech and got engaged in the research. Dr. Kazmikia Corbett can't be any older than half of our students, some of our students at the Seattle colleges. And she has spent the last 6 years of her career in Dr. Fauci's office. She's an AKA, and When folks see her, they say, I could be that. I could be another Dr. Kazmiki because she's young. And there are a lot of young Black folks and folks of color who are in those research situations, who are on the forefront, engaged in asking the kinds of questions. They're representing us at the outset. So we're very pleased for that. So folks, if you haven't had opportunity to do that, check out, go ahead and Google Dr. Kizzy. Dr. Kizzy Corbett, go ahead and Google the Surgeon General elect, who's a young Black man. We're there, folks. Dr. Matias, can you speak to the enthusiasm? You've been in public health for a long time. What does it mean for when, let's say back in, let's say 2008, when I know you started doing a lot of significant work here in the King County area around issues in the Black community and the communities of color, such as tobacco cessation and some of the other challenges that we're facing in our community. One of them was the scourge of HIV/AIDS. What's been the change in the face of those who have been able to do the research and being in front of our community to give that kind of support?
Yeah, and I think, you know, there's been there's definitely been a growing demographic shift in our communities, and in terms of we are on the road to being majority people of color already. More than half of those under 18 years of age in our county are from communities of color. So this shift has already happened. And then the other thing that's been happening is our institutions are changing. So I think that same body, for example, from the college system, that then come in with energy and are much more racially diverse, and then contributing to the changes, cultural change and systems and policy changes that are happening within places like King County are critical. So I think that's extremely important. And what I'm encouraged by is that when we you know, started this work and we launched, I've been one of the leads from the very beginning, our equity and social justice work back in 2008 under Ron Sims. We were spending our time making a case of why they were inequities in the county, and all our early reports were data reports, and we would just talk about the inequities that existed, and people were saying, oh wow, I didn't know that this existed. Now it's before us every single day. We see that people know the data, and people also see, as I was saying, it's both the chronic kind of slow things that actually have an influence on our communities and affect things like life expectancy, and then things like violence that we see, including police violence. So people have a level of knowledge that they did not have, and even our young people, it's different from, you know, I have you know, a daughter and stepdaughters. They don't have the same type of understanding. For me, myself, it took me a lot longer to get this level of consciousness and understanding of some of the issues. They're there. So I'm extremely hopeful in terms of where we are, and folks really focusing on the solutions and what we can do and how things can look differently. So I think the historical you know, progress in this, when you think about it through the years, I have been in public health now and in King County 20 years. You know, early on, we were talking about diversity. It was hard to talk about race. People did not want to talk about race. So to just have a sense of where we're at now and talking about the real issues and calling them out in a real way. And if you're not, then you're not living up to the expectations that we're all setting. I think that's extremely positive.
There used to be a time we had to actually hide behind the numbers because we couldn't talk about the lived experiences of people. And I remember it was very, very difficult. Now we could talk about the lived experience as data.
Yeah.
Back then it was like, oh, you don't know, you're only hiding behind, well, our communities didn't trust the data because it didn't include the lived experience. And the city systems and the county systems didn't trust if we wanted to bring the lived experience because they said, where are the numbers? We're in a whole different place right now. It's exciting. Doesn't mean that we don't have any more hard work, but there was a time, Dr. Matias, when you had to do more hat in hand, kind of moving, rather than to be bold like you have been in this conversation about talking about white supremacy in a way that we never could speak to in terms of public health crises, but particularly the crises of HIV/AIDS. that was a hard kinds of conversations that really couldn't have been, that were not able to be had in public spaces and in communities of color.
Yeah, and I think there's community organizations too have now been able to develop some tools, and sometimes they also have their own kind of research, and they do their own surveys and they get their own information, so they know how to lift voices and collect information and have it come from community. And I think also within public health and other institutions, there's been progress to realize it's not just that quantitative information that matters, is actually how do you combine the quantitative, the data, with the community voice, which is qualitative, and that's evidence, right? And I think, I have seen that shift, that we've been bringing that enough. Just if community is asking for it, it's valid. I mean, that is valid data that we need to be able to take into consideration. And it's, just as valid, if not more, from those numbers that we see. And then when you actually combine the numbers, the health inequities, health disparities numbers with the community voice, it's extremely powerful when you do that.
Yes. Thank you. Thank you for your hard work and making that happen, because it wasn't easy. Yes. And folks, if y'all have an opportunity, make sure to look to see what the work that Dr. Matias and his team has been engaged in. They have been engaged in creating ambassador, what we would call affinity groups in the community colleges and other spaces. But y'all have an ambassador program that goes out to, that's for young people as well, right? And also members of the community that involve elders. Can you speak a little bit about that?
Well, there's a lot of different things going on. So I don't know, I mean, which piece to focus on, because there are things going on as a county. I was previously director of the Office of Equity and Social Justice as part of,
Yes.
And started that office for 5 years. And now I've been back in public health since the beginning of the year. So yeah, we do similar affinity groups and caucusing and all those kinds of things. In terms of we have ambassadors, or also we have community navigators and liaisons, some that we've started now as part of this COVID work. And there's been now some investments as part of our anti-racism budget to have this as an ongoing function within the county, to have hire and support community navigators and liaisons. Right now we have 30 of them, who are trusted leaders in community, who are, on the one part, their voices and be able to share some of the public health information with community, and they're trusted and they're from communities, right? The other part is that they are also real-time voice back to us. So as part of our response with the pandemic, and similarly, we have to do this for our anti-racism work too, and we have been doing this, is incorporating the voices into how we need to adjust. So when things are not, so we are hearing from real time with community, we're on, for example, language access, we are translating on a regular basis into over 30 languages. Now, we were never able to do those kinds of things before, but we're doing that now. But then even we are hearing from our community navigators and communities, if they say, oh, we need to have these information in some other languages, we need to do this, we need to do more, we need to adjust our response, we need more testing sites in these particular areas. And that's a connection to community that I think, hadn't existed before, and we didn't have those mechanisms. So I think those are the things, again, the transformational nature of the current crisis that we're in, and crises, both in racism and COVID, is we have been learning about these, and we've had to adjust in real time. So we need to also, in the future, as we move forward, once the pandemic is behind, systems and structures and learnings to do the work in a different way and be more responsive to our communities, and being explicitly focused when we're creating programs. It's not around creating an approach, and that's how we did things in the past. We created one program in which you'd reach everybody a particular way. We need to be very targeted for the African immigrant community. We also need specifically people from Somalia, from Ethiopia, from Eritrea. I mean, we need to get very specific, and then specific for the needs of the U.S. born Black population. They're, not being able to come up with a just one size fits all approach, which at the end perpetuates the inequities. So now we need to be very specific about what we're supporting and what we are trying to do, and support the specific organizations. I talked about calendars previously and their effect with COVID. It's not just one community, right? There's Marshallese, there's a number of different, there's Chamorro, there's community. to be, and those take very specific kinds of approaches and investments for each.
Oh my goodness, I am so happy to hear this. This is like, this because this has been really a big concern is just, how to tap the wisdom of the communities and in the cultural values of communities to help protect us all and help us all have access to the tools of healing that we all need to have. So I love you. I'm just very happy about this. Thank you so much.
Well, thank you. And I mean, it's also, I mean, I think we have to stay very vigilant, right? Because we've been able to do some things, and then the weight set, there's a colleague of mine calls it autocorrect. There's this function in which we often just go back to the status quo. So how do we actually continue to move these things forward so we don't do kind of the dominant cultural ways that we have had before that are just going to always want to pull us back. So how do we continue to push forward? Because we're definitely not done. We're just getting started.
Well, and I think that's also, that's also one of the more, I don't know, the more abstract kind of values that are being modeled right now is about the adaptation and learning in public in real time and shifting policies related to what's actually needed. So that I think as a government institution, there's reparation work happening too in the response, and the kind of the inclusion and partnership with communities. So again, I am just so buoyed by the perspective. Thank you.
Thanks. I mean, one of the things too is we have amazing resources here in the county, right, and in our region. And I always say if we can't fix it here. My own background, I came, I left with my family from Chile in the 70s, the beginning of dictatorship. And my dream for a long time was to go back, and most of my family went back and now lives there. Now that democracy has been reinstalled, and they have plenty of the issues there. But my idea was always to go back. But honestly, I've stayed in the United States, one, because now my family is here, and my partner and kids and all those kinds of things. But more importantly, also, I think that there's work to be done here in our region because we have the resources, we have now the knowledge, we have all kinds of things to be able to actually make a dent in this in a place where other parts of the world you can't necessarily do it. So just as we are, a center of innovation and technology and all these other things, we need to be also a leader around equity. And if we can't really do it here in our region, I'm not sure where we can actually get it done, right? So I do think that there's a particular responsibility that we have in our region to really, can I do this work and do it right? And I'll be able to offer some models also to other parts of the country and even the world.
So as we get ready to close out our conversation, beloved brother, Dr. Matias, is there anything else that you want to leave with us about any top subject or anything else, any advice that you have for us or anything like that?
Yeah, I mean, maybe I think just a little bit of reiterating and maybe emphasizing some things that we've been talking about. I mean, I think we also often talk about race as a risk factor, but it's not race that's a risk factor, it's racism and the systems of racism that we have. And I think also some people begin to think about, and this is with our approach, in the county, we talk about conditions and environments because actually those are the biggest drivers of health and health inequities. So whether people have access to healthy environments and food and physical activity, good education, good paying jobs, those are the most important things. So I think as part of the solution, we all have a role to play in that. Some folks often begin to think about it, also often focus, and it's just the individualistic way that and the mentality and frameworks that exist in this country often talk about individual choice and freedoms and those kinds of things. We know, and this is why in public health, we know that actually access to healthcare is only a small bit or even the minority in terms of what is the major driver for health outcomes, right? And we know that it's these conditions, and at the end, these conditions have, when you don't have access to these contribute to your health in very detrimental ways. And more research has been done now in terms of chronic stress, how it increases cortisol, and then that makes you more likely to have diabetes. In terms of whether it's diabetes and asthma and heart disease, is across the board, it affects communities more. It's stressors and the influences of racism. So I think when we are doing this, we need to be, and doing this work, again, focusing on the problem, the root cause, and racism as an underlying issue here, right, is extremely important. And then to the extent that we can, let's learn from the work that we're doing. I think we need to document, we need to be able to learn on what we're doing, and then bringing it back to our schools. I think there's a lot of work. I mean, public health, and we are in government. There are a lot of similar efforts happening in the schools of public health and the colleges, such as with all of you, in which we actually need to be as a society, as a group, be able to build on these knowledges, and let's not repeat what has happened in the past. Because I think still the vast majority, we're not declaring victory. We have such a long way to go. I mean, I continue to think about here, and especially with vaccination, the healthcare system is going to have, there's going to be experiences of bias, there's going to be experiences of discrimination, there's going to be things that are going to happen to communities of color that are going to be hurtful. So I think we need to be thinking about how can we continue to use this moment now, systems, and continue to actually make sure that the future health professionals are in the education to be able to do the work holistically. The science is actually, one is they have to be from communities. They have to be from the communities and reflect the communities that we currently are. So there's some really work that needs to happen there, make sure that they're racially diverse, but then also have a holistic approach so people understand these broader issues and also the trauma that is inflicted on many of in our community, and be able to treat the whole person, right? I think so. These are the opportunities and the learnings, and I think right at this point nobody has an excuse in terms of saying we don't know necessarily what we need to do, because we know what we need to do.
Thank you for saying that nobody has an excuse. That's deeply, because once you see, you can't unsee.
And once we know that we can change on a pivot like this, that we can, that's also not an excuse anymore. So, yeah.
I would like to speak to one thing about this. I read in the news recently that, and actually Kizmiki or Corbett and Dr. Fauci brought this to our attention, that there's been a significant bump of people wanting to go into med school that are from communities of color, because they've seen Dr. Kizzy and Dr. Fauci and the Surgeon General, who was a Black person. They're saying, you know what? I can make a difference, and I can be in these spaces and places, and I can find myself at the National Institutes of Health. I can be working for one of the institutes that addresses diabetes or kidney or infectious diseases. So the future is looking good, because the future is going to go in and get in and spread out into those institutions that need to be transformed.
I totally agree. And I think one of the things that we saw after 9/11, how many people wanted to go into the armed forces and wanted to go into all these other areas. Now people are rushing to be in these other fields. So I so much appreciate it. And I also so much appreciate just the opportunity to have had this conversation with all of you. So thank you very much for inviting me today.